So basically, I'm not going to talk a lot about the patient circles. There is a source on this spreadsheet that I'll hand out in a second that talks about that has patients on it, but we're going to talk about more about other professionals in the community. Number one, your circle of influence. Let's start out here. Everybody has a circle of influence. You as a doctor, you as a hygienist, you as an office manager have a circle of influence. And this is set up for the dentist, of course. This is you in the middle, your staff, your patients, and your public. The closer to the center you are, the more control you have. Okay? You have total control over yourself. Your staff, a little less control. Your patients, a little less control. The general public, less control. Okay? It's kind of maybe a little disconcerting that you have less control over your patients than you do your staff, depending on how much control you have over your staff. But it works out, and I don't know what psychologist came up with this, but it's one of those laws like Joe Girard's law of 250 that really leads you out from the center. Referrals really what you're doing with a referral is you're really tapping into this circle of influence. I have a circle of influence. My dentist treats me, now I can go infect or affect my circle of influence with the good service or relaying the good service, becoming an evangelist. So what you're doing is you're taking this circle and you're making myself as a patient add to your circle. The key to this circle of influence is there are other sources of referrals that can make your circle of influence infinitely bigger. Now the patient may know 100, 200 people, but an attorney in the area, an accountant in the area, somebody else in the area knows infinitely more than that. You know, I figure I have 700 clients. Now I can't refer them to local because they're nationwide. But if I were an attorney and I had 700 clients that were local, you can see how big of a circle of influence I could add to your circle.